handling stress. And to guide us on this, we have with us Miss Urjita Deshpande. Ms. Urjita Deshpande is a clinical psychologist and behavioral skills trainer with an overall experience of 15 years. She has expertise in behavioral trainings, psychometric testing, and psychological counseling. She is associated with various corporates across industry verticals, including healthcare. She has been recognized for creating stimulating and interactive learning environment. For the convenience of everyone, we would be happy to take the questions at the last. Now, without taking any more time, I would request Ms. Urjita to please take over from here. Thank
Okay,
you.
thank you so much, Astha. A very good evening to everybody. So yes, today we are going to talk about stress management. And I'm sure, this word stress is not something new to us because we all have experienced it and it somewhat feels like this, right? Being roasted from all the sides. So what I'm going to do today is definitely, as I said, this is a very common topic which we all have experienced and which we have, seen in our life. Let me talk about those aspects which I feel are very important for us to know when it comes to stress management. Right. So now, as you can see in the slide towards your left hand, we have always believed, or rather most of us have always believed that targets and deadlines, or, that pressure to achieve that target and deadlines has always led to stress. But the truth is that it's not about targets or deadlines. It's about how I think, or what is the amount of pressure that I take with regard to that targets and deadlines actually leads to stress. Maybe this concept was known to many people, or maybe this concept might be, the first time that you're listening to it. So let us just walk through it because this is going to be the base of our stress management. I'm not going to go into the technical definitions of what is stress because I guess being doctors, you know much more. So now let us look at the various descriptions of stress which are being given by different motivational speakers. So what one of the motivational speakers says, it's not what happens to us, but it's our response to what happens to us actually is giving us stress. And response is something that we can choose. So for example, suppose if you're giving an interview, so it's not about that interview, which is stressful, but how I look at that process of interview is actually that is giving me stress. And now how I look at that interview can be changed only by me. So maybe I can work on myself. I can be more competent enough. I can practice sufficient. We all have experienced this in our life. Maybe when we were new in our professions, there was tremendous amount of stress because we were not very expert in whatever we did. So maybe our responses were not correct to the certain situations or the work that we did, right? So response is something that we can actually choose. Another way of describing stress, that stress is the result of, or stress gets created because of lack of skill or lack of emotional stamina. As I said, lack of skills. When we were new in the profession, maybe we were not that expert. So definitely when we were handed over some work, when the doctor said, look at this particular patient, and that was the first time I've been, handling such kind of patient, obviously it's going to be very stressful for me. But now repeatedly, when I handle those similar kind of patients, that kind of stress is not going to get created in me, right? So this is one factor that leads to stress. Another way is lack of emotional stamina. Now, a lack of emotional stamina, we are going to talk much more about it during the whole session because that is also one key factor of why stress happens to us, right? Another beautiful description of stress is that stress is a form of pain. Okay, it is a pain which is constantly trying to tell me that I need to change. So what stress indicates over here is that whichever situations are stressful for us, it is just trying to tell us that we need to change the way we are dealing with that particular situation or with that particular person. But generally, what happens is today we all have got used to this terminology of stress. We have believed that it's very normal to have stress. Rather, if you meet someone who says, I don't have stress, we feel he's, weird. Or maybe he has nothing to do in his life. But it's not about that. It's all about how you think. Now, stress majorly resides from this learned helplessness. Just as I was talking, learned helplessness is a condition in our life where we have now believed that certain problems in our life have no solution at all, right? So we have, majority of us have come to this belief that yes, certain situations are not going to change. Certain relationship which is wrong, whether it's in our professional life or whether it's in our personal life, we have somehow accepted it's not going to change. Or if there are some other issues which are pressing, we have now come to that belief that these problems are not going to change in my life because there's no solution to it. Even when you try to give them a solution, maybe they are not ready to take a solution, right? So the effects of the learned helplessness are that eventually that belief is so strong that no motivation techniques helps that person to look at that situation from a different perspective. I'm sure you must have encountered so many people where you try to help them of how they can come out of the situation, and they will always have this answer that yes, you're correct, but. So that yes, but attitude just creeps in, and which just does not allow them to break that cycle of stress in their life. Now, slowly, when I have believed that certain situations cannot be changed in my life, it starts affecting our state of mind and it can lead to depression. And such kind of depression, a person is not even aware of. We have heard this word depression, and we generally believe that depression is more about feeling sad, being in one room, secluding ourselves, not being interested in the activities or the worldly things. But depression does not always mean that a person is going to behave like this. Depression can be seen even in normal people who are coming and working with us, right? Depression has a different forms, and depression can be expressed in different ways. So definitely it starts affecting state of mind and it can lead to depression. Now the person develops helplessness in the other areas of life also, which actually could have been even dealt with. Now once a person has decided that certain situations in his life are not going to change, he has accepted that, right? Now this kind of a learned helplessness, there is a possibility it might creep into your other areas of your life which were actually going well, but somehow the depression, the anxiety, the stress that you have carried with regard to that one area, it is likely to infect the other areas of your life. And the obvious result is self-esteem loss. That is, a person now starts believing that he cannot do good things in his life, or he cannot achieve the success, or he always wants to blame somebody for his failures or for his not being able to achieve the dreams. But it has been proven scientifically that if your process of thinking and your attitude, if corrected, a person can come out of that learned helplessness state also. It just requires little bit of efforts. And today the problem is we put so much of effort in our professional life that if now somebody comes and tells me that I need to take efforts on this, maybe now I'm not ready for it, because I feel ki I am feeling stressed out because of my boss, or because of my spouse, or because of my children, or because of the financial problems. It's very easy for me to sit here and say that because of this, I am stressed out. It requires a lot of efforts and patience to say that no, the stress is not because of all those factors. The stress is because I am not thinking correctly, and I have to put efforts on thinking correctly, right? So definitely we have a hope in how we can deal with certain issues in our life. Now, stress and burnout. Definitely, we have heard about this word burnout also. Burnout can be typically said, that when you have stress for a long period of time, it's a prolonged stress, it is definitely going to affect your mental and emotional health. It also affects your body, definitely, for sure. Having blood pressure, I guess, doctors know it much better how stress affects the body. Symptoms of burnout. How do you identify that this person is actually having or experiencing that burnout? Is that they are just not able to cope with intense pressures and excessive demands. The employees get pushed towards a state of exhaustion, and it can also be expressed in terms of dissatisfaction about the work, lack of interest in work, having low energy, feeling fatigued or tired most of the times in the day. Even if these people get up in the morning, they might just not feel that energetic and fresh to just head for the day. Overall, there is this frustration, and there is something called as depersonalization that happens at the very extreme stage of burnout. Now, depersonalization concept is a very big concept, but just to explain it in short, depersonalization means he just starts feeling disconnected with everything in his life, and he just starts behaving in a very mechanical way. He will just do the things because he is meant to do the things, but there is no interest, there's no passion, there is no personal touch to whatever he might be doing, right? So these are all the symptoms of burnout. Now, definitely, if the employees are burned out, it is going to have a negative influence on the organization, because it's going to definitely lead to reduced productivity. A burnt out person just cannot perform to his best. So obviously, though he might be capable of doing a wonderful job, but all that capabilities are going to be washed out because of that high level of stress. So definitely it's going to reduce the productivity of the organization. The absenteeism is going to increase because a burnt out person definitely has a lot of physical symptoms. So his body is not going to respond in a healthy manner. Obviously, the medical expenses, the compensation claims, and the health insurance are going to come into picture. Now, who are more prone to experience this burnout? So all those people who work on the boundary jobs. Boundary jobs means who are the people who work in between, they're the connecting link between the organization and the external world. So generally it's like sales or marketing people, nurses, or customer care people. So these are the people who are actually more prone to burnout. When we say nurses, you will realize as doctors that many a times most of the frustration of the patient is being expressed towards the nurses. So even if the AC is not working, or if the food is not good, nobody is going to complain to the doctors maybe at times. But yes, definitely the nurses have to take the heat of the certain things which are not functioning correctly in the hospital. So nurses have to be taken more special care of. Then another category of people who can experience the burnout are those people who function, who have to put the actions and the policies of the senior management into practice. And when they know that the subordinates are not going to take these kind of changes in the policy in a positive way, so these are the people who are going to suffer the most. The management has taken certain decisions of bringing some change in the management techniques or whatever, and the subordinates are not going to receive it well. So those are the second category of people who can experience the burnout. And the third category is the type A personality. Now we have to judge for ourselves that do I belong, or do I have these type A personality traits in me? So how are these type A personalities? They are excessively competitive, they are achievement oriented, they are workaholics, they are obsessed with deadlines, they are very control oriented, they have this chronic sense of time urgency. It means always, nay, there's no time, so just let us do it quickly, quickly. And they have tremendous impatience, which can be expressed at times in, verbal aggression or even hostile behavior. Type A personalities always want to be number one, right? So even if they become number one, now they just want to be retaining that position of number one. So that is the extra stress. Having type A personality in us is also harmful, and having type A personalities with whom you have to work can also be very harmful. So it's type A personalities, though definitely they can prove to be very good for the organization point of view, but when it comes to interpersonal skills point of view or the stress point of view, I guess these people can create a lot of imbalance. Now, when we have spoken so much about stress, the first obvious question comes, that is stress bad, or is little stress good? So now there is something called as desirable stress, which is also known as eustress, which is it is believed that this kind of a stress, this level of stress is needed. So it's like, suppose if you have to go for an interview, and if there is little bit of amount of stress, then it always helps, because little bit amount of stress can improve your performance and your efficiency, right? So that is considered to be a good stress. Too little stress, no good, because it can just make us more lazy and casual in our day-to-day lives. Too much of stress, it can actually hamper the efficiency and lead to unproductiveness, right? And it is also called as distress. Now, what is the right degree of stress? As we were talking about this desirable level, too much level. Now, for each person, that degree of stress, that this is a desirable stress or this amount of stress is a distress, can change from person to person. Okay, so not everybody will get stressed out in the same situation. It completely depends on how that person handles that situation or how he responds, right? So now stress, first thing is, cannot be quantified. You cannot measure stress in terms of some number, or you cannot measure it in some term of some quantity. Each person has a different emotional ability to deal with certain problems in their life, or capacity to deal with the situations in their life. Now it's up to us to decide whether is this stress actually enhancing my ability, or is it actually creating a problem. So for example, if you're dealing with certain kind of a patient and there is that little bit of amount of stress, definitely it can help you to deal with that patient in a much better way. But the moment that stress exceeds, there's a possibility that it can create a problem also. So each one of us has to now decide for themselves that which level that you have that enhancing your abilities, and at what level now it goes into hampering it, right? Stress is not about situation or people, it's about how we look at that situation, right? And that decides the magnitude of stress. So now when we take the situation that is happening today, COVID-19, you will see there are different ways of looking at it. There are certain people who are sitting at home, who are not even working in the hospitals, but they might just read and look at the news every day, and they might simply get very stressed out. Oh my god, what's happening in this world? When is it going to end? What's going to happen to me? So he's actually safe. He's simply safe sitting at home doing nothing or doing his daily jobs, but just looking at that news can create a lot of stress. Whereas there might be another person who might just look at the news for once in a day and say, okay, fine, theek hai. Now let me see when, till when is the lockdown going to work. There might be certain set of people who will not even bother to switch on the TV, because they will simply, believe into this philosophy that why to open the news and take that stress, right? So now it completely depends on person to person of how they want to look at the situation and how they want to deal with the situation, and that decides their magnitude of stress. Now, definitely, the more we work on ourselves, that is the key to keep our stress in the right degree. Effects of stress, again, I'm not going to talk much, but all I want to stress over here is the stress first happens in our mind. It's our mind that starts creating stress, and then it trickles down to our body and our relationships, right? So it starts with the mind. So if we can stop it at the level of mind, it might not go down to your body as well as affect your relationships. Now, let us look at the types of stress. There are four, basically, they have been categorized into four types. One is the acute stress, which is for a small period of time. Like I said, interview hai, and so there is a stress for that small little point of time. Or maybe you were just about to meet with an accident and you just, pushed your brakes very hard. So that few moments, your heartbeats raised, everything, you were very stressed out, and then after 5-10 minutes you felt relaxed, right? So that is the acute stress, which lasts for little bit of time. Then there is something called as a chronic stress, which is an ongoing issue in our life or ongoing reason. So it can also be something that every day I have to go and travel. So that is like a chronic stress, dealing with the traffic every day or dealing with certain pressures in the office, so which is an everyday affair. So now that can be categorized into chronic stress. Then there are another two types of stress. One is the visible stress and one is the invisible stress. Let us look more into this visible and invisible stress, because that is where we will actually know how to manage our stress. Now, certain visible stresses are where we can see. So suppose if you are having a stressful colleague, or certain situations in your work life are stressful, definitely you can see that because of this, I'm feeling stressed out. So there are certain family issues which are quite obvious, like, or maybe health issues, that somebody is not well in our house, or somebody is, having financial problems, or somebody's got caught up in some legal issues, or there are certain relationship problems going on, fights between the spouses, or there are some relationship issues going on in our office. So you will see there are certain areas or situations of our life because of which we can completely come to a conclusion that yes, because of this problem, I am having stress. But now there are certain invisible factors also that give us stress. And what are those invisible factors? Those are, first thing, our negative attitude and negative thinking. Like I gave you that example of how a person would look at COVID-19. Now, the more negative attitude, the more you're going to worry, the more you're going to complain, and that is going to lead to stress. And generally, we have never considered our negative thinking as the reason of stress. And that is the major reason of why we have never been able to manage our stress also. So this is one of the most important points, rather, I feel, in your stress management. Many a times, not being able to express yourself can also lead to stress. So for example, in your professional life, there is something and going on in the relationship between the boss and the subordinate, or between the two doctors. Many a times we are not able to express ourselves. That can lead to stress. Then beliefs and conditioning, wrong belief systems. Okay, wrong belief systems can be something like, the world is like this, things are always like this, I always work so honestly, like, and still, people are, behave such kind with me, the world is not a good place, or it's very difficult to earn money, whatever. So we have to check for ourselves what are all those belief systems and negative belief systems. Now, many a times, beliefs sound and look very real. Beliefs have come because of our experiences only. So it's not something that these beliefs are wrong, or these beliefs are, no, we have taken up from somewhere. But the point is, if this particular belief system is negative, then we need to re-look at it from a different perspective, because that same belief might not be true for the other person. And if something is not true for the other person, then even you get that hope, ki fine, can I look at this particular wrong belief in a different way? Right? So suppose if I say that life, or my workplace is just not a good place to work, I need to change, or the world is not a very good place to live in, people are very mean, and I have to always take care of myself. Now maybe the another person might not have the same kind of a belief, right? So time to check our beliefs and our conditionings that are there in our life. The next reason of stress is not being assertive. Right? Assertive means at times we have this feeling that people take advantage of me and I'm not able to say that no. So when we are not able to say a no, that can lead to stress, because maybe I was just about to leave for my house and suddenly, I get some work. Now, if I'm not able to say a no, it is going to create a stress in me. So when we are not being assertive, when we are not assertively saying a no, it can be one of the reasons of stress. Then fears and insecurity, that is also one of the major reasons. And these fears are many a times very subconscious. They act in, or they show up in a very subtle way. Many a times we are not even aware of the kind of fears and the insecurities that we have in our life, right? So insecurity can be, what will I do if I leave this job, or will I get some another good opportunity or no? Or the fears might be, what people will think, what people will say, what if I don't do this, what is going to happen? So there are n number of fears. Then fear of criticism hai, fear of rejection hai, that can create the stress in us. Then the next is need to be number one. So as I said, yes, the more you have that desire to be number one, the more it's an open invitation for stress. Because being number one, maybe you reached that number one, but then there would be somebody who's still striving and he achieves more than you. And then again, now we strive to achieve more than him. So this again gets into a very vicious cycle of being that number one. Wrong habits. Now, definitely, we all would agree that there are certain habits in us which are not good. We also know that we need to do something about it, but we don't do anything about it, or we do something about it, but then we don't have a discipline to continue in the right direction, and that can also lead to stress. So that wrong habits can be, maybe you want to leave smoking or drinking, or maybe you need to get into some kind of a good thing, like not doing the things we should be doing. So for example, maybe we want to exercise, we know that our health is getting compromised, and I need to now put efforts in doing some kind of a workout and take care of my body, but somehow we don't do that, and that can also give us tremendous amount of stress, right? Now you will see that the visible stressors and the invisible stressors, they all play equal amount in our life. And now let us look at how we can deal with all these stressors in our life. What exactly we can do to manage our stress, right? So to manage our stress, the first approach, which is very necessary for us to have, is that people and situations are not stressful. We create the stress by our wrong thinking about them. Until and unless we do not believe this statement, believe me, n amount of sessions or anywhere you go, you will simply not be able to manage the stress. Because when we say that people are responsible for my stress, it means somehow we are giving the remote control, or we are giving the charge of our life in their hand. So the moment they press the right button, we have a right emotion. The moment they press a wrong button, we can have stress. The moment they press another wrong button, I'm going to get angry. So first approach to stress management is, people and situations are not stressful, we create stress. So if my life has to be stress free, then it's not the outside factors that need to change, but it's the inside aspects that I need to work on. So till we are going to say that until and unless the hospital does not change the policies, or until and unless, I don't have a compassionate boss, my life is not going to change. It's not going to work like that. So if my life has to change, situations outside can be anything. If I start working inside, definitely it's going to bring about a change. And our skills to do the work and emotional health determines how we can deal with work, situation, and people. So working on enhancing our skills and emotional health is the key to stress management, right? So these are the first few beliefs that you will have to accept, without which the further steps are not going to make sense actually. Now, how do deal with the visible stress? So if suppose there are certain things in your work, family, relationships, finances, it's always needed that it's time to take a decision. We need to take a decision. Many a times the problems in our life are because we don't take decisions on them. We simply leave it to time. We simply say that, oh, time will heal it, or maybe let's see in future what happens, just let me wait and watch. So that wait and watch can create more wrong situations, and that can lead to stress. So taking a decision, very necessary. Delegating, many a times too much of work pressure can lead to stress. So you have to now see and check for yourself that what are the things in your life, or what are the work that you can actually delegate it to people, so that you can give your time to something which can make you more productive. Definitely time management is very necessary, which can help us in dealing with these stressors. Talk it out. Okay, talk it out means it's very necessary that we need to talk about our issues, because when we have somebody to share with, it makes us release our that pent up emotions. So always talking your stresses out with some of your close members, it can be family members, it can be your friends, always works as a good therapy for your stress management. And dare to change. Now dare to change basically simply says that at times, to deal with your visible stressors, it's very necessary to take certain risks in your life. It might also demand to bring a certain change in how you lead your life, or how you are operating with that life. So we need to bring that change factor in us, and at times we need to take that step. Okay, fine, this is the decision now I have taken to deal with my stress. So that is the reason, dare to change. So these are the ways that maybe can help you to deal with visible stress. Let us look at how do you deal with the invisible stress, because as I said, visible stress are actually visible. So fine, I can see that these are the reasons in my life that are giving me stress. invisible stress factors are always ignored. We generally do not pay attention to these factors. But now it's the time that we need to look at those factors, because otherwise, again, as I said, stress management is just not going to happen. So, first thing is awareness about your thoughts and feelings. How do you think in different situations? How do you feel? So suppose if your boss has scolded you or said something which was not pleasant, how did you feel? How did you think about that boss? Now all this can either create stress in me, or it can just simply let go. So suppose if my boss has scolded me for something, or as I said certain unpleasant, if I'm feeling bad, it's very necessary for me to acknowledge that yes, I felt bad. Maybe I felt insulted. I felt very hurt. Whatever is your feeling, it's very necessary to acknowledge to yourself that yes, whatever you felt was not good. And it's okay to feel that way. Okay, see, when we say positive thinking and positive attitude does not mean that you should not get affected negatively from any incident. No. Positive thinking or positive attitude says that situations can be anything. Can I look at the situation in a better way? So that does not say that you should not feel bad, right? So acknowledge that yes, I'm feeling bad, I'm feeling hurt. Now check your thoughts. What were the different thoughts that came into my mind? Did I feel bitter? Did I feel bitter for my boss? Did I start hating my boss? How did my thoughts run? Or did I say to myself, whatever he said was right, maybe next time I need to be more careful? Or did I tell myself that maybe he was upset and that is why he said certain things, otherwise he's not that kind of a person? So now awareness about this thought process and feeling process is very important. If we do not check the thought, so suppose if my thought process is going in a wrong direction of bitterness, anger, now it's going to simply complicate my life, because now with that bitterness and anger is going to remain with me, right? The next day I go to the hospital, or I go to my workplace, that same kind of thought is going to now again pop up. So today maybe he was not angry with me, or he did not say anything unpleasant to me, but that thoughts which I created yesterday are going to pop up even today. So now even today when I meet him, those thoughts are going to affect my behavior. And then eventually, slowly, it starts creating a stress in me, because every day I see that person, it's going to create that stress in me. So please check, be aware of what kind of thoughts run into your mind when you encounter some unpleasant situation. Next point is awareness about how you interpret the situations. Many a times, we have this tendency to interpret it in a wrong way. So suppose, if we have given a task to somebody that, please do this work, and they have not done that task. Now, immediately we would want to interpret the situation. See, you take me for granted. That is why you don't do it. Or you don't take me seriously. That is why, you are always casual with me. So now many a times we might simply interpret the situations in negative way, which starts creating stress in us, right? So we need to be aware of how we interpret the situation. The next is awareness about the personality factors. As I said, if you are type A personality, or if you have that perfection kind of a personality that you need perfection in everything, now that is obviously going to give us stress, because the definition of a perfectionist person of doing a work can be completely different from a definition of a person who is not a perfectionist. So perfectionist people are always prone to feeling more stressful in their life. So can we work on our perfectionist personality? Can we let go certain things, is what we need to now start being aware of. Many a times you will realize that stress happens because of too much of competitive nature or whatever, and at times you feel it's good. I mean, there's nothing wrong in having competitive spirit, or there's nothing wrong in having that feeling that I want to be number one. Yes, there is nothing wrong in feeling that you want to be number one, or you are achievement oriented. But the point is, if it's taking its toll on your mind and body, then we need to put a full stop to that racing mind or that racing thought. Right? Then last is awareness about how you deal with your fears and your insecurities in life. So we need to first make a list of what are the things that we actually fear, And what are the things that we actually have insecurity about? Many a times these fears and insecurities are only in the mind. Maybe they don't even exist in reality, but because we have never done that check, that is this fear actually real, or is it just imaginary, or is this insecurity real? Like, so for example, a person might have this insecurity that what if I lose my job? Now, maybe the conditions are not like that. He has a secure job, he has a secure income coming, and he is actually happy. But just that fear or that insecurity in his mind can constantly keep him under that stress levels, right? So, we need to first check our own fears and insecurities, which can, we can eliminate and we can actually work on them. Being doctors, you also understand that diagnosis is very important, right? If the diagnosis is correct, the treatment is correct. So now diagnosis is actually introspecting that what is the cause of my stress? Is my wrong thinking pattern? Is my habit of interpreting or assuming too many things, which is actually not real many a times? It might be real few times, but it's not real every time. Is it my certain personality aspect which is leading to stress, or it is certain fears and insecurities that I carry? Maybe because previously my experience was like that. So now we have to now sit and diagnose what is the reason of our stress. Once you get that diagnosis, then it becomes very easy for you to actually hit that particular reason, right? So now, as they say, another factor is dealing with the energy suckers. Now, why this concept of energy suckers has come, you will realize whenever we are stressed out, it actually drains our energy, right? And when we feel drained out, then we just have no capacity to deal with situations. So suppose if I'm already in stress and tension, and I go to my office, and suddenly, one of my subordinate comes and tells me ki, ma'am, there is one problem. Now, obviously, because I was stressed out, I will just not be in that state of mind to now listen that there is one more problem. I might simply blow up, or I might simply, shout at him and tell him, "Ki, is this the time to tell me? Just let me breathe, just let me settle down, and then come and tell me what's the problem." Right? So, stressful situations or stress in the mind always sucks our energy, and that is the reason it is said that first we need to see to it that are our energy levels absolutely correct, because situations are going to come, and if situations are going to come, then the only thing that I can do is deal with all those other factors that suck our energy. And what are the factors that suck our energy? First thing is our negative self talk. Okay, negative self talk means the things that we talk with ourselves. You will realize constantly we are thinking about something or the other. Right now also, when you're listening to me, I'm sure you all are thinking something, self talk is happening inside. Now you need to check that quality of self talk. Is it more about complaining ki, see, this hospital is just not like this, they just don't have these facilities, this is wrong, that is wrong, in this hospital it's always like this? So are we always in that complaining self talk mode? Do we exaggerate the thoughts? Like, if suppose there was a small mistake done by somebody, and we simply blow that whole thing out of proportion just by using a wrong vocabulary. So suppose if a small mistake was made by the nurse, and we say, how can you make such a terrible mistake? Now, maybe that terrible word was not needed for that kind of mistake that had happened. But still, that exaggerated words we use, and that creates a mess up in our thoughts. And last thing is keep a tab on the assumptions and the stories that we create about certain situations in our life, right? So, first is our negative self talk. Obviously, it's high time that we stay away from negative people. And negative people means those who are constantly gossiping, or discussing about the same issues and problems that happen in their life. They can go on and on for years together. They can talk about the same things, the same problem that is there in their life. And also, let's not try to be the part of conversation which is having a negative theme, because all these things can actually suck our energy, and today we require energy. And last thing is, watch what you feed your mind. Watch what you feed your means. Watch what you feed your mind means we need to be really careful of what we are watching on the television, or what we are reading. or what we are listening to. Because if the content of what we are watching, reading, or listening is violent in nature, is destructive, or it has a sad theme, or it's very a traumatic story, or it is some horror content, or it is not a very pleasant content, now it is something that you have fed your mind with that. If you are going to eat this junk, obviously the body is not going to be nourished, right? So as doctors, we know that the more you feed your mind with some healthy food, your mind is going to be easily thinking negative. With feeding negative things, it's highly impossible for us to create a positive thinking, right? And that is the reason, surround yourself with positive people, those who are optimistic about life and who can help you or give you strength to deal with the problems, right? So these are the things that you can do to deal with your energy suckers. One more aspect is, take charge of your life. So take charge of your life means, it simply tries to say that in any situation, it can be absolutely any situation in your life, there will be certain things which are just not in your control zone. So for example, expectations and the pressures to achieve the targets, or what are the targets that you get, or the personalities of people with whom you're working. Now over here you have just no control zone. What temperament of patient is going to come, what is his kind of personality, is not in your control zone, right? So in every situation there are certain things which is not in your control zone, but still, to deal with it, there you still have certain choices. That is, if I'm not able to deal with that particular person or a situation, we can always take help from people and enhance our skill, and that circle is called as a circle of influence, where we can take help to deal with that particular situation. And always, whether that help will be of help to me or no, that is a different story. But always, in every situation, there is something that we can always do which is in our control zone. And that control zone says, ki, okay, fine, what is it that now I can do or I can change about myself, so that I can deal with this particular issue. So it can also be that how can make this journey of achieving the targets easy, right? So when you look at every situation from these three circles, you will realize that for every difficult problem in your life or every stressful situation in your life, there is still something which is in your hands, which is in your control zone. If you start focusing on this area or this circle will start expanding. And the more your circle of control increases in size, the more your stress levels are going to go down, right? So this is also one of the methods to actually deal with your stress. Setting a me time, obviously, which is very necessary, for which generally most of us have this excuse that we don't get that time. But let me tell you, it's very important. Having that me time, in that me time, you can just practically do anything that you would enjoy, because that is going to be the wonderful stress releasing time. So make sure that every day, at least that half an hour, even if not much more time, but at least half an hour you can always give to yourself, where you can just do whatever you like. You can meditate, you can just have that quiet time, you can sit and introspect, you can just enjoy that cup of tea, just do anything. But that me time is very, very necessary. And lastly, some daily stress management techniques are definitely breathing techniques. They help a lot in releasing your stress. So doing a lot of breath exercises are going to help you. Physical exercises, definitely very good. Yoga and workout. Meditations, I guess meditations have proved that they can reduce your stress level, they increase your mind power, they also help you to become positive in our life. So meditations have a lot of benefit. Put yourself into that practice of self introspecting. As I said, it's very necessary to sit back and introspect what is giving you stress. As I said, because it's not about that person or a situation, it's about how I look at them. So every day, take out some little bit of time. You don't need to maybe take out that time specially, but whenever you're cooking, or when you're driving, or when you're just having your lunch, maybe when you're sitting and having your lunch alone, you can utilize that time, because anyways we all are doing a lot of self talk. So why not have that self talk as an introspection time, right? And last thing is counseling therapy. That is talk, or talk therapy. As I said, when you speak to somebody, it definitely makes a difference. and life coach programs, generally such kind of sessions where a lot of personality issues are dealt with or stress related issues are dealt with. Attending such kind of sessions also can help a long way in managing your stress, right? So basically, friends, I guess this was all about stress, and definitely if you have some questions, I would love to answer them. Yes, Astha, any questions?
Yes, there are
Yeah,
few questions.
yeah.
So, Dr. Lalit Mohan wants to compliment. He's
Mm-hmm.
saying a very good talk,
Mm-hmm.
but he's writing, as doctors, we are under tremendous pressure.
Hmm.
Patients overload all problems like medical, non-medical, social, emotional, financial
Hmm.
pressures from hospital management, government laws, threatening and violence and fear,
Hmm.
pressure from family members and peer pressure.
Hmm.
There are no fixed formulas as such. So
Hmm.
he is asking for some relaxation methods, which could be suggested.
Okay, here instead of giving some relaxation methods, I would strongly recommend that work on your emotional body. Work on your emotional body means give time for meditations, because that is one thing that will build your emotional stamina. And secondly, take care of your lifestyle. And this is something that I always tell the healthcare people, the doctors and the nurses, that when you're taking care of somebody, first important thing is take care of yourself first. So now when I say that emotional stamina means be very particular about what you're feeding your mind, because as I said, all that stress happens in the mind first. Okay, so how do I take care of my mind? By taking care of what I'm watching on the TV. Fine, news channels and everything, it's better that you do not watch it in the night time, because that influences our sleep. And if we don't sleep properly, it's going to get into that vicious cycle. So first thing is be very careful of what you're watching. The content, let it not be heavy. It can be something comedy, it can be something light, it can be something informative, like National Geographic channel you're watching. So you will have to bring that change in your lifestyle. Secondly, be very sure that you are not mingling with negative people who constantly talk negative. So you have to just switch off or get up from that particular situation when you realize that people are now sitting and gossiping. So yes, these are the certain things that you will have to do every time. Watch yourself. What are you feeding your mind? As doctors, we also know that what we feed our body completely decides how our body is going to be. So yes, watch what you feed your mind is the key factor for doctors. Yes, Astha.
Okay. So next one comes from Soumya. So she's
Mhm.
asking, how should I adjust to changes in life faster and positively?
So faster and positively, there is nothing fast, unfortunately. Everything needs a little bit of effort. So it's just like saying that I cannot lose weight in 1 month. I cannot lose 20 kgs in 1 month. It has to go with the speed that is required. So when we are talking about stress management, it's not going to happen fast. There are no quick fixes. You will have to work on it. You will have to experiment and then decide for yourself which technique works. Or for this particular person, I need to use this. For this particular situation, I need to take care of this. So you will have to give that time. Nothing happens fast, unfortunately. I'm really sorry. Yes, Asta.
Okay, so the next one comes from Mr. Amit. So
Mm-hmm.
he's asking, what about taking a decision and after that stress becomes more due to repercussion of that decision?
Then it's time to change the decision again. See, trial and error is the part of life. It's the way of life. But not taking a decision is not a good decision. Fine, you might take a wrong decision at times, or maybe it proved to be wrong. When you took that decision, obviously you knew that maybe this decision is going to help. That's the reason you took that decision, right? Nobody takes a decision knowingly, oh, it's not going to work. So I guess, trial and error method has to be used in this, right?
Yeah.
Yes.
So the next one is, I think all of us would want to know about this.
Hmm.
Every time when I try to do some medication or exercise, something keeps on going in my mind that
Hmm.
some work needs to be finished first, and then I can probably meditate when I'm free. But then it never happens.
Yeah, this is a very common problem, and that is the reason they say that if you can get up early, at least 15 to 20 minutes early, that would help. Because if you get up 15, 20 minutes early, at least for that 15, 20 minutes, you won't get bothered. or the thing is that finish off your work and then do the meditation. But as you rightly said, then later on we just don't find time for meditation. But yes, now as I said, if we have to do something about our stress, we will have to take efforts. Nobody of us likes exercising too, but then you doctors always tell us na, that we need to exercise, and we follow it and we make time for it. So now as a psychologist, I would say ki yes, taking up that little time for ourselves is a must. It is just not uh, whether you want to do it or no, it's not a choice, it's a mandatory thing that we have to do it. So maybe you can just try getting up a little bit early, so that that can solve the purpose. Yes.
Okay. So the next one is anger and stress. Are the
Hmm.
both same or different?
uh yes, more or less it's the same, you can say, because anger also leads to stress, and stress can make me angry. So yes, they go very much hand in hand. They are like cousins, or you can rather say twins only. They just go hand in hand. Yes.
Okay. So the next one says, I am an HOD in a big corporate hospital.
Mhm.
Whenever I go to meet the MD of the hospital for review meetings or performance review, it
Mm.
stresses me a lot. I get anxious and fearful. Please suggest a solution.
Okay, so over here, I would suggest that first thing is identify what makes you anxious. Is it his response that you are anticipating that is making you anxious, or maybe there is some problem from your side of presentation that is creating that anxiousness, or what is it exactly? That needs to be introspected and that needs to be hit on, right? Because definitely it's possible that you might feel anxious, but then what exactly is giving? Does his personality and aura only give you anxiousness? Then that's a different thing. So once you are able to diagnose it properly, what exactly gives you anxiety, it can be dealt with. Yes, Astha.
Okay, so the next one is, on one side, we are trying to help our patients in best capabilities with
Hmm.
honesty,
Hmm.
but we are equally worried about medico legal issues and violence if the patient is not responding as per their relatives' expectation.
Hmm. If the patient is not behaving as per
If
relatives.
the patient is not responding as
Huh.
per their relatives' expectations.
Okay, okay. So see, yes, definitely, I agree that this is a very common problem that many of the doctors have mentioned. That we do our jobs very well, but at times there is always this insecurity from the patient side, right? So for that, I always give this one suggestion, that developing rapport with the patient is very necessary. So for that, quickly, I would like to give an example. Suppose I'm driving a two-wheeler, and if somebody hits me from behind, now I'm very angry, I'm very upset, I just want to know who did this, how this could happen. And then suddenly I see, oh, he is one of the person who stays in my same building, and I know him very well. Now it's not possible for me to shout or create a tantrum, in that particular situation. But suppose if it's the same situation, that somebody hit my two-wheeler, I'm very angry, I'm very upset. I get down and I see that some random person has done it. Now there is a possibility that I can, get back to him. I can, fight with him. I can make sure that he compensates me for whatever damages have happened to my vehicle, right? So the point over here that I'm trying to put forth is that if you can invest that time in building rapport with the patients, that can help. Because once you have a rapport, even when the patient is unhappy or whatever, he might not take some drastic steps, or he might not take some obvious actions. He might maybe tell it to you, but he might not take this issue a little bit further. And when I talk about rapport building with the patient, it does not require any time. Rapport building happens in the first 30 seconds of your interaction with the patient. Your rapport completely depends on how you smile when you look at that patient, when you offer him that seat, when you wish him and you greet him. That warmth, the moment he gets that warmth, he will automatically be connected to you, right? So I would suggest for this particular scenario, because there is no other way out, it's just that develop a relationship. Once a relationship is developed, it will be difficult for the patient also to take some drastic steps. And relationships can always be helpful for doctors. Yes, Astha.
I think that was a wonderful suggestion. All must implement that. We all
Yeah,
can.
yeah,
So
yeah.
the next one is, what about the stress of thinking on insecure future about liabilities, job, money, etc.? How to deal with this?
I lost your voice actually, Asta. Can you repeat the question?
Hello,
Ha, yeah,
am
yeah.
I
Well,
audible now?
yeah, yeah, yeah.
So what about the stress of thinking about insecure future about liabilities, job, money, etc.? How to deal with this?
Okay, now I would say that many a times these fears or these insecurities are something in our mind. So again, let me give you an example that before you actually started driving, maybe you had lot of fear about that driving. Oh my God, how am I going to drive? Will I come to, do it properly? Will I hit somebody? So there was lot of fear about that whole process of how I'm going to drive that two-wheeler or that four-wheeler. But when you actually started driving and when you actually hit that road, you realized, oh, it was not that difficult. It was just more scary in my mind, right? Or maybe even with regard to certain patients or certain interviews, you must have realized that our mind is always habituated to, creating a lot of fear, unnecessary. It will just exaggerate and blow up the things out of proportion. So all we need to do is just burst that balloon. Let's not believe what our mind is saying, because whatever our mind says, most of the times it might not be true. The situations might not be that bad. Okay, so there is no need of letting that mind think about the future and losing the job or financial insecurities or whatever. So here I would just suggest that whenever you start thinking such kind of thoughts, just put a full stop, divert your mind, do something else. Okay, do something else. So every time you just need to stop that and do something else. That's the only way of reducing. Once your mind comes to know ki, oh, this person is just not ready to think this, it might stop creating that kind of thoughts. We need to start playing with our mind actually. Yes, Astha.
Yeah. So, ma'am, there is a request coming in from the audience if they can
Mhm.
have your email ID. So, if you can just move the slide.
Yes, sure, sure. I would love to answer your questions.
Yes. So,
So
we'll
you
take
can,
the last one. So, we
yes.
have the last question from Soumya. So,
Mhm.
she wants to know how to deal with stress of parenting a young child.
Oh, stress of parenting the young child. Actually, again, I guess, that stress is going to happen because it is something, just because we don't know how to do that parenting, that stress is likely to happen. That is why parents generally say that it's easy to deal with the second child, because by the experience of that first child, now I have learned certain things. And so it's easy for me. Yes, always children, bringing up children can be a little bit stressful at times. So maybe I need to know what specific things she's stressful about. So maybe, Soumya can connect with me on my ID, email ID, because I need to know specifically to give her a specific answer. Yes, Astha.
Yeah. Thank you, ma'am.
Yes.
So, with this, on behalf of Dr. Reddy's, I thank our speaker and all the participants for taking time out. I wish your day is full of positivity and good health, because good health can't wait. Jai Hind.